Hello everyone, my name is PUVANESWARI THANIMALAI. I'm a first year medical student. So the specialty that I took is gynecology, but particularly I'm going to present about the female reproductive system, the uterus. So let's focus on the structure of the uterus first. So the uterus is a thick-walled, pear-shaped, hollow muscular organ. Non-gravid uterus is approximately 7.5 cm long, 5 cm wide, and 2 cm thick and weighs approximately 90 grams. The non-gravid uterus lies in the lesser pelvis with its body lying on the urinary bladder and its cervix between the urinary bladder and rectum. Uterus can be divided into two parts, which are body and cervix. As for the ligament of uterus, broad ligament act as a mesentery for the uterus and contribute to maintaining it in position. Long ligament function to maintain the anteverted position of the uterus. Ovarian ligament joins the ovaries to the uterus. Cardinal ligament contains the uterine artery and vein in addition to providing support to the uterus. Uterosacral ligament provides support to the uterus. So as for the innervation of uterus, the blood supply of the uterus derived from uterine arteries with collateral supply from ovarian arteries. Uterine veins form uterine venous plexus on each side of the cervix. Parasympathetic fibers of the uterus are derived from the pelvic splenic nerves, which is originated from S2 to S4. Sympathetic nerve fibers of the uterus arise from the uterovaginal plexus. The cervix is largely innervated by the inferior nerve fibers of the uterovaginal plexus. Okay, next let's see the histology of the uterus. We are particularly going to talk about the body of uterus, which contains three layers: perimetrium, myometrium, endometrium. So the perimetrium lined with a simple squamous epithelium and composed of areolar connective tissue. Laterally, it becomes the broad ligament. Anteriorly, it covers the urinary bladder and forms a shallow pouch, the vascular-uterine pouch. Posteriorly, it covers the rectum and forms recto-uterine pouch. Myometrium contains three layers, which are subvascular layer, vascular layer, and supravascular layer. The subvascular layer mainly participates in the sealing of the tubes and the separation of the endometrium during the menstrual cycle. The vascular layer plays a major role during labor. The supravascular layer is a thin sheet of crossing muscle fibers stabilizing in the uterine wall. Endometrium is highly vascularized. Endometrium is divided into two layers, which are stratum functionalis and stratum basilis. The stratum functionalis lines the uterine cavity and sloughs off during menstruation. The stratum basilis is permanent and gives rise to new stratum functionalis after every menstruation. So that is all from the histology. Now let's focus on biochemistry of the uterus. In biochemistry of uterus, we're going to mainly talk about the hormones. So the hormones we're going to talk about is progesterone, estrogen, relaxin. Progesterone secreted by cells of corpus luteum. Progesterone prepare and maintain the endometrium for implantation of a fertilized ovum and prohibit the muscle contraction in the uterus. Estrogen secreted by ovarian follicles. Estrogen enhances and maintains the mucous membrane that line the uterus. It thickens the lining of endometrium for embryo implantation. Relaxin, like a small quantity of relaxin produced by corpus luteum, relaxes uterus by inhibiting contractions of the myometrium. At the end of the pregnancy, relaxin increase the flexibility of the pubic symphysis and help dilate the uterine cervix. Okay, now we're going to talk about the cycle of the uterus. What are the cycles it undergoes? So first, menstruation phase. So during menstrual phase, menstrual flow from the uterus consists of blood, tissue fluid, mucus, and epithelial cells shed from the endometrium. Declining level of progesterone and estrogen stimulate release of prostaglandin that cause the uterine spiral arterioles to constrict. The entire stratum functionally slow off. Endometrium is very thin, about 2 to 5 mm. After menstrual phase, proliferative phase occur. During this phase, estrogen secreted by growing ovarian follicles that stimulates the repair of the endometrium. Cells of the stratum basilis undergo mitosis and produce new stratum functionalis. Endometrium thickens, endometrium glands develop, arterioles coil and lengthen. After that, ovulation occur. So rupture of mature follicle and the release of the secondary oocyte into pelvic cavity occur during ovulation. High concentration of estrogen stimulates the release of GnRH from hypothalamus. It also stimulates gonadotrophs in the anterior pituitary to secrete LH. GnRH promote release of FSH and additional LH by anterior pituitary gland. LH causes the rupture of mature follicle and expulsion of the secondary oocyte after the peak of the LH surge. And then we also have luteal phase. During luteal phase, progesterone and estrogen produced by corpus luteum promote growth and coiling of the endometrial glands. Vascularization of the superficial endometrium, thickening of endometrium to 12 to 18 mm, and the preparatory change peak about 1 week after ovulation. If fertilization does not occur, the level of progesterone and estrogen decline due to degeneration of the corpus luteum. Decline in progesterone and estrogen level cause the menstruation, and the whole cycle will happen all over again. Okay, the world-known expert in gynecology is Dr. James Marion Sims. And James Marion Sims was an American physician in the field of surgery. He's also known as father of gynecology. So J. Marion Sims, born in Lancaster Lancaster County, South Carolina. He is the son of John and Mahala Sims. At first, Dr. Sims studied at Lancaster Village. In 1825, he was sent to the newly established Franklin Academy in Lancaster. In 1832, after 2 years of study at the predecessor of the University of South Carolina, Dr. Sims worked with Dr. Churchill Jones in Lancaster, South Carolina. He took 3-month course at Medical College of Charleston. He moved to Philadelphia and enrolled at the Jefferson Medical College. The contribution he gave in 1853, Dr. Sims had the largest surgical practice in the state of any doctor in Montgomery up to that time. Dr. Sims developed a precursor to the modern speculum using pewter spoon and strategically placed mirror to check the vagina. He performed experimental surgery on women to treat vaginal problems and research more about gynecological diseases. He developed techniques that have formed the basis of modern vaginal surgery. Sims established Women's Hospital in New York to repair vesico-vaginal fistulas. Development of surgical technique for the repair of vesico-vaginal fistula, a severe complication of obstructed childbirth. Dr. Sims invented the Sims position, which is a position used for rectal examination, treatments, and examining women for vaginal wall prolapse. Okay, last but not least, the disease that I chose for my presentation is uterine cancer. Cancer of uterus occur when abnormal cells develop in uterus and begin growing out of control. There are two main types of cancer, which is endometrial cancer and uterine sarcomas. Endometrial cancer begins in the lining of uterus. Uterine sarcomas develop in the myometrium. So let's talk about the stages in uterine cancer. During stage 1, the cancer is in the uterus. Stage 2, the cancer spread to the cervix or stroma. Stage 3, the tumor has spread past the uterus and cervix but not past the pelvis. Tumor spread to vagina, ovaries and fallopian tubes. Stage 4, the cancer has spread past the pelvis and is within the other organs such as intestines. Causes of this disease, it can be because of taking tamoxifen to treat breast cancer, or being postmenopausal or reaching menopause, or starting early periods before the age of 12. Okay, the symptoms of this disease is abnormal pap test result and pelvic pain. Second symptom, painful urination. The third, pain during intercourse. The treatment can be given for uterine cancer is, of course, first surgery and also chemotherapy. That's all from me. Thank you.